we're obviously a nonprofit here in Grand Island. We don't receive state or federal funding like Heartland Health, so we're different than them. We're all privately funded, and so we're able to see people. We mainly see people who are both uninsured and low income, and we see them for everything from medical, dental, pharmaceutical, and then we have our community garden and food pantry. So this is Jen. I'm gonna let her, if you guys wanna come this way, this is where the dental room is, but Jen can see people. You can talk about a little bit about it, but we have an x-ray machine and things like that. Go ahead, and then I'll take them this way.
Okay. So I'm the hygienist, and so what I do is mainly cleanings. I do have an x-ray machine, a panel machine to take x-rays, but our services for dental are very limited, where I'm the only dental personnel that works here. We don't have a dentist on site. Our services are limited to cleanings, and then I do take x-rays to make extraction referrals to 3 different offices where we have dentists that volunteer some of their time for our patients, but they limit it to extractions only. So we take uninsured patients. Dental, we do make the exception of taking Medicaid patients depending on the situation, because it has become an issue of them trying to find services here around town. But other than that, the dental side is a little different than the medical.
And I should say that, so everything that people come here for, there's no charge for anything that we do. So we never charge it for anything. So yeah, this is the dental side. And if you come this way, you'll see this is our medication closet. So we do a lot of pharmaceuticals. A large portion, I would say about 60% of our patients have long-term health conditions that we have to like help them monitor, and pharmaceuticals is a key part of that. I'd say about 60% have diabetes. So a lot of our patients are coming here a lot for like diabetic supplies, needles, insulin. So if you want to poke your head in here, you can. So basically we have 2 drug programs that we work with. One is Medicare, which is an international program. That one we don't pay for. That one is very unpredictable as to what we can get every week. And then the other one is Dispensary of Hope, which is a national program where we pay $7,500 a year, but that gives us unlimited access to pharmaceuticals, including insulin, which insulin is very expensive. So we always have refrigerators full of insulin of all different kinds for people. Because when I first started in 2013, we didn't have drug programs. And so we came across a ton of people who were like rationing their insulin or rationing metformin or all of these different drugs that they need. And so we've been able to get away from that and really provide not only free pharmaceuticals, but one of the other barriers we were having was people would have to leave here to go to USAVE on 4th, and that's a barrier for people that don't have transportation in general. But then also we were only able to cover like things that were $10 or less, whereas now we're able to have it in stock here. So mainly people leave here with their medications at hand. And we see people, for everything from like physicals, kids going back to school, people who have, are sick, like just have a cough or things like that. And then those long-term medical conditions, like diabetes, hypertension, those types of things that we help them with. We ask people ask a lot if we do any like mental health. We don't. Like we usually send that over to Mid-Plains, but if they're already on like a regimen of things, we can give them if the doctor feels comfortable giving them like antidepressants and things like that. But yeah, if you want to poke your head in there, you're more than welcome. And then we're entering our medical clinic side over here. But yeah, feel free to look around. So this is where the medical patients come. We have 3 exam rooms. And this is our Marty cart. So this is what we use for interpretation services, which is new to us last year. So that screen right there, if you have anybody come in that you have a language barrier with, you can see on that screen that you just touch that language of the person. I think there's over 300 dialects on here. And then within 20 seconds, a live person pops up on the screen, and then they're able to translate for you. So that's been a really big lifesaver, because it's really makes people feel a lot more comfortable. Because when I first started, they were telling people to like bring in an interpreter. Oftentimes that's their child, which in a medical circumstance, there's no reason a child should hear their medical condition before the adult. So we've been able to get away from that. But yes, Marty Carr is great. But yeah, this is where we do all of the medical clinics. And then we're moving over here. This is our boardroom. And if you notice, like some things are out of place, we're in the middle of a remodel. So that's why not everything's done.
Hello everyone, I'm Kelly. I'm the nurse that works here. So if you have any questions about inside, you can ask me. I'm sure Misty got them all, but we'll show you. We've done a community garden. Last year was a really productive year, and this year we've got a lot of produce out there too. A lot of it's donated, some we've purchased with grants that we've gotten money from. The weeds are more our friends right now than we'd like. It kind of got overtaken, but we'll walk out there. In addition, this year we did add flower gardens here in our raised beds, I guess. So those have been fun. But we'll walk out here. If anybody loves to garden or pull weeds or needs volunteer hours or knows of anybody, send them our way. But we've got lots of cucumbers, tomatoes, peppers. Anything we produce out here, we do pick and we take inside and put in our donated food bank. So Misty and I kind of just try to keep it up with watering, weeding, and weeding got out of hand this year with all the rain, which has been wonderful, but we'll walk through here. So we've got a cucumber bed here, and they've done pretty good. They're starting to get to their tail end. Lots of peppers in this bed here, and you guys can wander on through. We have a great strawberry patch back there. These we started early with like herbs and stuff, and those were done early spring, so we didn't get a second round planted in there. Lots of tomatoes. Hopefully they're gonna turn for us. I don't know. Mine at home are not turning yet either, so we'll see. Yeah, and then some tomatoes in these two plants and just oversee the weeds. But we've got lots of options to grow and add more. Our peppers are doing really well. Yeah. The patients really love it. They've been asking about tomatoes, if they're ready yet. I'm like, they haven't turned, I don't know, but we don't typically let them come out here and pick just because we don't want somebody to get hurt. We think somebody likes our strawberry plants over there and finds those because we never have any to take inside, but it's all right. As long as we're serving our community, that's the goal.